Thank you so much for being here today. I wanted to take this opportunity to talk about the importance of endometrial receptivity testing for some patients who are pursuing infertility treatments. My name is Lauren Hurst. I am a nurse and medical science liaison with iGenomics. I am a patient advocate, and I believe that all patients should have the opportunity to explore their options for infertility treatments, whether they have been struggling for some time or even are new to reproductive endocrinology. I think it's important that all patients are aware of their various options. Today, I am joined by Cyndi, who has graciously agreed to offer her testimony with regards to her experience with infertility treatments and ultimate success utilizing iGenomics' receptivity testing. Thank you so much, Cyndi, for being here. I wanted to allow you this opportunity to talk with us for a few minutes about your experience and what led you to ultimately taking that moment to explore your receptivity before pursuing your ultimately last embryo transfer.
Thank you for having me, Lauren. I appreciate it. Like so many of those out there, I had no idea how many women struggled with infertility until I myself discovered I was going to need to start that journey as well. My husband and I have been together for a very long time, and I was really work driven most of my life and just got really into my work journey, climbing the ladder, doing those types of activities, and just realized one day, I believe I was around 37 years old, that, hey, having a family was important to me. And I really needed to buckle down. And we had been together for so long, and it had not happened naturally, that I may need to seek some help and some guidance. So we decided to do that and found out that through some testing and some an IVF round that there I was going to be having a big struggle. I was going to have a big struggle ahead of me getting pregnant, but we were on board. Having a family was very important to us, and so we decided to take that journey. So that was my original reason for starting with infertility treatments.
Tell us a little bit about your infertility treatments as far as the number of transfers that you had completed prior to deciding to pursue endometrial testing.
Sure. So we did the egg retrieval. We had some really good eggs banked. And we did our first transfer was a fresh transfer. We transferred one. We went through all the medication, the journey through that. We transferred the one. And after a period of time, we had the test and found out that we were pregnant. And then we heard the heartbeat at the infertility doctor's office. And I was released to the OB. And so I went to the OB. And at that first appointment, I found out there was no heartbeat. So I was very hopeful and, discovered that it does work. Infertility treatments do work, but I'd lost that first one. So through a period of transfers, I want to say there were 3 of those that we did. We transferred 2 per transfer. None of the following 3 worked. There was no sign of pregnancy. Nothing worked for those. And then we had 2 remaining. The final 2, for us, we did not have insurance to help us with any of the financial burden infertility brings to a couple or a person who's trying to get pregnant. It was all money out of pocket that we had saved. And it was a very big bill for us, as most of those out there know. The last 2 that we had were pretty much going to be our final 2. It was either these 2 were going to work or they weren't going to work, but we desperately wanted them to work. And we had consulted with the doctor before our final transfer of the 2 embryos, and said, hey, doctor, what do we need to do? This is it for us. We really want to maximize our opportunity for these 2 to work and, be successful. And it was just a numbers game at that point, is what we were told. But our sweet nurse reached out to us a few days after that appointment with the doctor and said, look, I want you to try this. I really think it might help you and it's worth the shot. So she told us about ERA, and how it could narrow the journey as far as the medication application. What is my specific instance? When does my body is the optimal time to take that medication? And it really just gets me off of that calendar that everybody is on during that cycle and narrows it down to Cyndi. What does Cindy's body need to maximize the results of this transfer? So we said, sure, we'll do it. I mean, what do we have to lose? These are our last two. The cost was minimal compared to what we had already paid. So that was a no brainer for us. As far as the process is concerned, to me, it's very similar to a cycle. I mean, you go through the same process. It's just at the end, that's when they do the testing, to see. I would say the testing at the end wasn't painful. I just remember the freezing part of when they were going to retrieve to see, what does all that look like for me. But I would do it again because I do have to say the only thing we did different on our last two was this test. And my husband and I just say we really feel like this was why we got pregnant. And I can only speak to my instance because I know how many we had went through, the same process, the same calendar that every other person was on. But this test told me that I needed to delay the progesterone a day or so. And then the application, instead of doing it at night, I needed to do it in the morning. So I followed it to the T, and went all the way through exactly as it told me to do. And when we went in for our blood test, found out that it was showing that we were pregnant. And then when we came in for our heartbeat, we had two. Both of them had taken. And I can tell you that just seeing them there, both of them, I really feel like ERA was the reason. And I get so emotional. I remember that day so well, looking at that, being so happy and so proud that I took that test. Um, and I can only speak to me, and I just want everyone to know that if you're struggling the way we struggled, that it is worth it for you to give it a try. Because if you were in a situation like we were, we're like, this is it. If it works, great. If it doesn't, this is it. We'll just have to accept it. And it worked for us. So our babies are, we had two boys. They are 5 years old. They are the light of my life. I tell them all the time, Mommy prayed so hard for you that God gave us two. So I really do appreciate the suggestion of ERA. And it's very important for me to share that with others who may be going through the same journey that I went through.
Absolutely. Thank you so much. That is an amazing testament to your perseverance and your patience with the process and really trusting the journey. And ultimately, it brought you great success. And I think it's really important for other women and patients to know that this is an option that may work for them. It may bring them that additional information that they need. And without that information, they wouldn't know if they're transferring at the right time. And so I think that your experience speaks to really the importance of evaluating receptivity in some patients who aren't having success doing things the way that their clinic would routinely do them. Is there anything else that you want to offer patients who may be experiencing something very similar to what you're going through, a word of encouragement or anything to offer those patients?
I would say the journey was very difficult emotionally. I would say for us that we just need to give ourselves grace, and understand that as much as we want the pregnancy to happen and result in a birth, I think just give yourself some grace and understand you're going through a lot. I understand what you're going through. Other women are going through it as well. But definitely want to tell you to consider this test. It really helped us. And if you're at the last leg of your journey and you're looking for one more thing to see if it'll work, definitely suggest you taking this test.
Thank you so much, Cyndi. I really appreciate your time. And obviously your words of encouragement may offer a patient out there that encouragement to continue on with this journey in hopes of obtaining a successful pregnancy and live birth just like you. Thank you so much.
Thank you, Lauren.